Can you use too much fillers? Yes. I call it the filler effect. And it's becoming increasingly more prevalent in society. Like, you know, the fillers that we have now for soft tissue augmentation or enhancement of the face, for facial rejuvenation and aesthetics is just getting bigger and bigger and bigger. Like, it's become more prevalent. Like, there's more and more products being released, different consistencies of the hyaluronic acids, different types of products being created to provide a soft tissue augmentation. It's not going to get, they're not going to be less. It's only going to get more. Unfortunately, in my opinion, this is my opinion here, is that there's women who don't want to have surgery, and there's men also don't want to have surgery for facial surgery for rejuvenation. And so one of the kind of intermediate kind of alternatives is having fillers. And what fillers do really for the aging of face and rejuvenation is that it kind of causes, it camouflages shadows of the face. And so like areas like along the folds here, the mid face, you know, the jowling area, like when you put fillers in certain areas, you're able to kind of, you know, soften the shadows by augmenting the soft tissue with the filler. And it will make the skin a little bit tighter, which gives us, there's more of a youthful appearance. But, you know, as we age, what inevitably happens, and this is something you cannot stop, is that the aging process is relentless. Like, you will get older, your soft tissue will get thinner, you're going to lose collagen in your soft tissue. Gravity is going to take place on your face and your soft tissue, in your entire body actually, and pull down. It's just the way we age. You cannot stop it. So slowing it down with fillers is really just, you know, it's a very, very slow process. You want to be, in my opinion, you don't want to be over aggressive with it. And if you need a facelift, you need a facelift. You just need to reestablish the soft tissue structure, the architecture, resuspend it, you know, augment it with some fat to rejuvenate the fat loss that comes with aging. But try to compensate with the fillers alone. You'll see what I'm talking about. You see them on social media. You see them on, you know, in the celebrities, and they just look weird. They look odd. They look very overfilled. Like, that overfill effect is something it just makes me cringe every time I see it. It's just, it becomes like this snowball effect for patients. They get so, like, not addicted to it, but they see themselves so much, and they like the way they look when they get their first fillers, that they keep chasing that. And because the fillers dissolve, and they're like, oh, I need to go a little bit fuller, I need to stretch my skin out, so they put more and more and more, and the next thing you know is you can't recognize them at all. That's the filler effect, in my opinion. And so I'm hopeful that as society kind of recognizes that that's not, you know, what people want to look like, that there's going to be a pullback more to a natural appearance. And hopefully the providers doing these injections are going to embrace that and not overfill patients. And so when a patient comes in and they look like they're overfilled, and, you know, I want to have 2 syringes of whatever into my lips, hopefully that provider will be like, you know what, let's rethink about this. Like, is it going to look good? Is it, you know, is in the long run, is this going to help you? I mean, how long can you maintain this? Like, you got to have those more realistic discussions with the patients as a provider. But there's some people that just want that aesthetic look. That is, you know, what they want, and that's okay. But you need to have the discussions with your patients if you're a provider providing these fillers. In my hands, it's more of a natural look. The idea is that I don't want you to look like you're augmented. It's just to slow down the aging process, age gracefully, is what I like to say. And we just want to look a little bit younger longer. And so there's ways to do that. It's a combination of maybe some fillers here and there. We do skincare. Skincare is huge. You know, we have a great line of skincare in our spa. And I highly recommend that women, you know, once you hit about 30, you start really making skin your priority as you age, because if you're able to keep your skin young and healthy and vibrant, you will age better. I guarantee it. So it's more about preventative aesthetic medicine. I tell patients that all the time. Preventative aesthetic medicine, the sooner you get started, the better, the more younger you'll look longer as you age. So just a key fundamental in aging naturally and gracefully. So hope you learned something. Don't forget, like and subscribe, send me a comment on the comment section below, and stay tuned for more.